Thank you so much for having us here today, and to that incredible, incredible panel. Another round of applause. I'm going to keep this brief because we have an exceptional panel coming up. My name is Dr. Chethan Sathya, and I'm a pediatric trauma surgeon and the director of our Northwell Health Center for Gun Violence Prevention here in New York. This is a center of excellence in research and clinical care that was founded by our CEO, Michael Dowling, back in 2020, with the sole goal of charting a public health approach to our gun violence epidemic at a time when few in the healthcare sector were actually prioritizing this from a leadership standpoint. As many of you have heard, in the United States, the leading cause of death among kids is not car crashes or cancer, it's gun violence. And this is unfortunately a reality that myself and many of you in the crowd deal with on the front lines every day. I started my journey about 5 years ago treating a 6-month-old with a bullet wound. I never imagined that I would have to do this. And this case actually, as you can imagine, continues to haunt me. I remember this baby girl, I remember what her eyes looked like, and I remember how beautiful her earrings were. And I remember how quickly the blood was coming out of her body as I had both fingers on those bullet wounds. Unfortunately, this was not the last horrific case that I had to experience. Day in and day out, in Chicago back then, and now in New York where I work, our trauma teams have had to treat numerous kids with bullet injuries week after week. In fact, here in New York at our Level 1 Pediatric Trauma Center, where many of my colleagues are here today, we had a 350% increase in the number of kids coming in with gunshot injuries in 2020. And just to harp on something that Nicole and Anthony mentioned, for folks who aren't from the US, this is a complex epidemic. Right? When we talk about gun violence, we're talking about firearm suicides, accidental or unintentional injuries, public mass shootings, and community violence. They are each very, very different, but we see kids affected by all of it. This uniquely American epidemic, as I mentioned, can affect any community as a result. Urban, rural, black, brown, white, it doesn't matter. Anyone can be affected. And that's why 5 years ago, we started this Center for Gun Violence Prevention. Our CEO, Michael Dowling, feels incredibly passionate about this topic, and along with a number of other healthcare leaders, we've been working over the last 5 years to change laws, conduct research, implement life-saving strategies, and try to increase public awareness. So today, I'm proud to announce a Clinton Global Initiative commitment to action that we are making to expand and scale some of our evidence-based strategies within our health system first, and then nationally across every large health system in the country. Firstly, we have a very unique program that we're going to expand called a universal screening program. At our hospital, we actually ask every single patient who comes in about gun injury risk. This should be a healthcare conversation. A lot of the interventions you heard about, whether it be safe storage counseling or violence intervention, are conversations that a doctor can have with a patient. The evidence shows it can save lives, but very few doctors actually have those conversations, so we're looking to change that. And as a result, we can destigmatize and normalize that conversation. Our goal is to screen 430,000 patients and offer resources to those patients as part of this commitment. Secondly, we're going to expand hospital-based violence intervention that you heard Anthony talk about, really bringing our community violence intervention organizations into the mix as part of our health system. And number 3, we want to expand our public education efforts. We want to reframe the discussion, continue to reframe, as many of our partners have in the audience here, reframe this as a public health issue, and educate the public on common sense solutions. We have a lot more commonality. I can tell you now, after doing 50,000 screens at our health system, we have yet to meet one American family who doesn't want safer communities, no mass shootings, and to keep their children safe, and to have a viable future. We have yet to meet one. We're proud to work with local community-based organizations on this commitment and national partners like the Ad Council, Brady, and others to get this commitment done. And 5 years from now, we are going to reach 500,000 patients and impact over 3 million folks from the ripple effect and the public awareness work that we're doing. Gun violence did not become a leading killer of kids overnight. Here in this country, it's going to take all of us. We stand committed alongside many of our panelists and folks in the room today. Thank you so much.